Brooklyn Independent Television.
For a woman, it's one of the most troubling diagnoses she can get: breast cancer. Though our knowledge of the disease is far more sophisticated than ever before, breast cancer still brings with it fears of death and disfigurement. Every year, well over 200,000 American women get that diagnosis. October is National Breast Cancer Awareness Month. It also marks the first anniversary of Mammograms Hospital's new breast cancer center. And here to tell us about it and to talk about where we are in terms of treatment is the center's director, Dr. Donna-Marie Manassi. Thank you very much for being here this morning. So who gets breast cancer?
Well, thank you for having me. Breast cancer actually happens to any woman. In our breast center, we see women from all over the world. It's one of the reasons I came to the Maimonides Breast Center. We see women of Jewish descent, we see women of Arab descent, we see Caucasians, African Americans, Caribbeans. Many women get breast cancer.
And do men get breast cancer?
Actually, they do. Men are susceptible to breast cancer, not as frequently as women, which is why men don't necessarily need a mammogram, but men do get breast cancer. And I often encourage men, if they happen to feel something on their exam, when they're taking a shower, they probably should come in as soon as possible to have it evaluated because they are susceptible to breast cancer.
I had not planned to ask you this question, but you said when they do their exam, because there's been controversy lately about whether or not women should actually do breast exam. So would you talk about that as a part of screening, and then we'll get to the other screening?
Sure. The controversy around breast self-exams is whether or not it's worth, quote unquote, doing a breast self-exam. Does it actually help you find breast cancers easily? And my thought has always been, I tell my women the same thing, it doesn't hurt to do it. It's an easy enough exam, it's free, you just use your hand. And you can find something that you won't be able to detect necessarily on mammogram because you had your mammogram 6 months ago. Breast cancer doesn't wait for your mammogram to show up, it can show up in between mammograms sometimes. And because of that, doing a self-exam may help find that.
I'm glad you said it doesn't cost anything and it doesn't hurt to do it. What I used to teach my patients is actually to teach your partner to do it. And I thought that they really liked that. And so you can do it yourself or you can teach your partner how to do it, right?
I absolutely say the same thing, actually. Because I think it's something where it's an important thing to do, it doesn't hurt, and having somebody else do it if you're not comfortable, that's another concern some people have, that it causes a lot of anxiety. They don't know what they're feeling, but somebody else who maybe is familiar with the area might also know what they're feeling and feel something different. And I've actually had some patients whose partners have picked their lump up.
So we don't want women to miss that opportunity.
No, we don't.
To have someone else examine the breasts when they do it with sensitivity. Now, tell me about screening. There's been so much controversy about when to get screened.
Screening, one of my favorite topics. The controversy around screening is when is actually the right age to have someone screened. And presently the recommendation is to get screening at age 40 if you're of average risk. No family history, haven't had an abnormal biopsy. Average woman walking in should get screened once a year at age 40. The controversy was whether that was the right age. Should we wait till we're in our 50s? And a little bit
Well, wait a second. Is it start when you're 40 and do it every year, or start when you're 40 and do it every other year until 50?
So the controversy is around that as well. We recommend, as does the American Cancer Society and other societies that treat breast cancer, to do it, start when you're 40 and do it every single year. So an annual exam with a mammogram every year starting at age 40. The controversy is whether we need to do that. Should we do it starting at age 50 and doing it every other year, or should we even do it starting at age 40 at all for the average risk woman?
So when you get a mammogram, that by itself is not anything except uncomfortable. Are there any new screening techniques that are available now, commonly available, not research available, commonly available screening techniques?
Well, there are a number of actual other imaging modalities that we use for the breast. And as I mentioned, for the average risk woman, we usually will use a mammogram. But if you're at an increased risk, we often will add other imaging tools like an ultrasound, a breast ultrasound. People who have had children are familiar with what ultrasounds feel like, or an MRI. And I think that's where the importance of understanding what your risk is can help evaluate whether you just need a mammogram or do you need a mammogram, ultrasound, and MRI as part of your screening.
And when you do a mammogram, do you do a mammogram and an MRI, a mammogram and a sonogram at the same time so that you see the breast at the same time with the two modalities, or do you separate them?
We usually like to do them together because the mammogram, particularly for dense breasts, may not show as much as we'd like it to do, and sometimes the ultrasound can assist with that. Also, if the mammogram shows something unusual in a particular area, it can be further evaluated with an ultrasound to see if that something, quote unquote, is either something solid or cystic.
When women get screened and they get their result that says you're fine for now, sometimes they go for 2 or 3 or 4 years and don't get screened again, and then they're fine again. Is that encouraged? Do you think that that's something that encourages women to not do it as regularly as they should when they get a second one that's normal after waiting many years? And would you say that if you've had, the way we do with pap smears, if you've had 3 or 4 consecutive pap smears that are normal, you don't have to do it every year or every 3 years anymore. Is there any such thing when you're doing screening for breasts?
Unfortunately, for breasts, it's not necessarily the case. Breast cancers can grow slowly over time. And actually, when a mammogram picks up a breast cancer, it actually may have been there for a number of years before, just not seen on the imaging because it has to get to a specific size or do something to change the structure in the breast for the mammogram to pick it up.
What size in general? Could you give us a common item that we all know? Is it a pea size? Is it a walnut size? What size can most imaging pick up an abnormal mass in the breast?
Most imaging, it's a bit of a complicated question. Most imaging for a fatty breast, so a woman's breast doesn't have a lot of dense tissue, probably can pick up about a centimeter or a little bit smaller, which is probably the size of a pea or a little bit around the size of a pea to the middle of a grape. If you have dense breasts, however, sometimes it may not pick up a mass that's bigger than that because the density of the breast happens to match the density of the cancer. But you can pick up other things like calcium deposits. It looks like you sprinkled salt on a mammogram. And cancers don't just present as one way on a mammogram. Some women get calcifications, which can be associated with cancer. Some women can get a mass or change in the actual architecture of the breast tissue on the mammogram. There are many different ways that cancer can present on a mammogram. So to your original question, the reason we wouldn't want to do a mammogram every 2 or 3 years is a cancer can potentially grow during that time and be picked up by a mammogram annually.
At the top of the time we started talking about it being your first anniversary of your center. Can you tell us something about the center?
I'm very, very proud of it. It's the first year anniversary of the Maimonides Breast Center at the Gilbert Rivera Pavilion at the Maimonides Cancer Center. And it's a center that actually was opened about a year ago with the purpose of providing excellent care to patients in Brooklyn for breast care. And this center is particularly wonderful, not only because of the design of the center, the infrastructure is beautiful. It looks like you walked into a spa, actually. It's actually because of the team that's at the center. Everyone has come from some of the top institutions in the country, providing excellent care in their field. The imaging center is a breast center imaging of excellence. The center itself, within that short 1-year period, has been accredited by the American College of Surgeons as providing all the standards that the college feels are top in terms of providing excellent breast care. So we're fortunate.
So it's a center of excellence, not only for screening and so forth, but for surgery, for breast surgery.
For breast surgery, for treatments, including medical radiation oncology, for all the care that you need for a breast cancer patient, and for general breast health as well. We don't just treat breast cancers, we also take care of women with benign disease as well.
Now, one of the things that we need to mention is anything that's new with treatment. Women are very fearful about getting breast cancer or getting the diagnosis. What's new in the treatment of breast cancer?
I think there are many things, fortunately, that are new in the treatment of breast cancer. I think one of the most important things is that early detection still matters. So we start with the screening and the pick up early front. We've developed technology that picks up disease a lot earlier. So we've gone from analog or film mammograms, kind of like a film camera, to digital mammogram, kind of like your digital cameras, that picks up disease a lot more quickly and easily than a film mammogram can. We've also developed other technologies like using ultrasound and MRI. At our center, we actually have a high magnet, a 3T MRI, which also has a lot more sensitivity than the traditional 1.5, which is used at other facilities. And then instead of just the imaging, we've also picked up better ways of detecting the cancer through biopsies. We do a lot of needle biopsies instead of surgical biopsies. Needle guided by the imaging. That's a very important thing to mention because in the past, everyone would just go into an operating room, take out the area. Now we actually can take a small sample and understand what we're taking out when we actually go in the operating room, saving a woman from an extra surgery.
I hear that you have a special event coming up. Could you tell us a little bit about it?
We have a number of special events, but the most special event we have is on October 6th. It's the Ride to Live. The Brooklyn Bikers, along with the rest of our staff, is going to start at the Mammograms Breast Center and ride from the 64th Street to Sheepshead Bay to increase awareness and spread the word about breast cancer being treatable.
We only have a minute or so left, but if you would leave one message with our audience today, and it's not just women because breast cancer is a family affair, what would that one message be to the women that are listening today?
I think the message is early detection leads to treatment and curing of breast cancer, and that early detection starts with screening. And for the women and for their families, increasing awareness is where it needs to happen. Because the more knowledge you know, the more you can actually benefit, because you'll have more information about getting a cure.
And if you need more information, you can go to the Mammograms Breast Center.
Absolutely, we'd be happy to have you.
So early detection is still your best protection.
Early detection is definitely the best protection.
Thank you so much for being here.
It was my pleasure.
Watch this and other Brooklyn Independent Television episodes online at brickartsmedia.org/BIT.